Lindsay M. Clancy, Plaintiff. 5th Jennifer A. Tufts, MD, Rebecca H. Gelada, CNP, Astor Mental Health Inc., South Shore Health System, Inc., McLean Hospital, and Women and Infants Hospital of Rhode Island. Defendants. This is an action for personal injury and loss a consortium brought by Lindsay M. Clancy. This action arises from the catastrophic failure of multiple medical providers to properly diagnose, treat, and monitor Lindsay's severe postpartum psychiatric condition, despite her repeated, desperate pleas for help and her family's persistent efforts to obtain adequate care. Lindsay Clancy did everything a mother in birth situation could do. She recognized something was wrong with her. She sought medical treatment. She went to emergency rooms. She called crisis hotlines. She admitted herself to hospitals. She took the medications prescribed to her. She communicated her worsening symptoms to her providers. She told them the medications VV are making her worse. Her husband advocated for her. Her family drove from out of state to help care for her children. And still, the medical system failed her completely. The defendants, Jennifer A. Tufts, MD, Rebecca H. Gelada, CNP, Astor Mental Health Inc., South Shore Health System, Inc., McLean Hospital, and Women and Infants Hospital of Rhode Island, each failed to properly diagnose Lindsay's bipolar disorder with postpartum onset, and instead subjected her to a disorganized, uncoordinated course of polypharmacy that exacerbated her condition and precipitated a severe psychotic break. Lindsay S. clinical course VVAS, significantly complicated by polypharmacy, and the involvement of multiple prescribers, VVHH, in effect, obscured an accurate diagnosis and appropriate intervention and treatment, even though Lindsay did all that she could to obtain the appropriate treatment. The psychotropic medications Lindsay received appear to have paradoxically exacerbated her underlying psychiatric vulnerability, precipitating a state of manic psychosis characterized by compelling command hallucinations. The tragedy that followed was the direct and proximate result of the defendant's collective negligence in failing to recognize obvious VV warning signs, coordinate care, properly diagnose Lindsay's condition, and provide treatment that met the applicable standard of care. As a direct result of defendant's negligence, Lindsay suffered catastrophic physical injuries, including permanent paralysis, and she lost her 3 beloved children, Cora Marie Clancy, Dawson William Clancy, and Callum Patrick Clancy. Lindsay No VV faces a lifetime of physical disability, psychological trauma, and the unbearable grief of V waking up every day, knowing she killed her children, all of which could have been prevented had defendants provided competent medical care. Pades. 1. Plaintiff Lindsay M. Clancy is a resident of Massachusetts VVHO, at all relevant times, resided in Duxbury, Massachusetts with her husband Patrick Clancy and their 3 children. Lindsay was a registered nurse who worked in the labor and delivery department at Massachusetts General Hospital. She is the mother of Cora Marie Clancy, Dawson William Clancy V, and Callum Patrick Clancy. 2. Defendant Jennifer Tufts, MD, is a psychiatrist registered to practice medicine in the Commonwealth of Massachusetts with a usual place of business in Braintree, Norfolk County, Massachusetts. 3. Defendant Rebecca H. Gelada, CNP, is a certified nurse practitioner registered to practice medicine in the Commonwealth of Massachusetts with a usual place of business in Weymouth, Norfolk County, Massachusetts. 4. Defendant Astor Mental Health Inc. is a Massachusetts professional corporation with a principal place of business at 325 Wood Road, Suite 209, Braintree, Norfolk County, Massachusetts. Astor employed Dr. Tufts and is vicariously liable for her negligent acts and omissions. 5. Defendant South Shore Health System Inc. is a Massachusetts nonprofit corporation with a principal place of business at 55% Fog Road, South Weymouth, Norfolk County, Massachusetts. South Shore employed Nurse Gelada and operated the perinatal behavioral health program through which Lindsay received treatment. South Shore is vicariously liable for the negligent acts and omissions of its employees. Defendant McLean Hospital is a psychiatric hospital located in Belmont, Middlesex County, Massachusetts. McLean provided inpatient psychiatric treatment. McLean provided Inpatients Hospital of Rhode Island is a hospital located in Providence. Women and Infants operated a partial hospitalization day program for patients with postpartum depression, where Lindsay sought treatment in late December 2022. Jurisdiction and venue. 8. This court has jurisdiction over the Massachusetts defendants under GLC 223A, Sections 2 and 3 because they either reside in Massachusetts, have a principal place of business in Massachusetts, and or their actions and inactions that caused the injuries at issue took place in Massachusetts. 9. This court has jurisdiction over the Massachusetts U.S. defendants, Dr. Jennifer A. Tufts MD, Rebecca H. Gelada, CNP, South Shore HLFH System, under GLC 223A, because they reside in Massachusetts, all Massachusetts, and or maintain their principal places of business in Massachusetts. This court has jurisdiction over Women and Infants Hospital of Rhode Island, under GLC 223A, over Women and Infants Hospital of Rhode Island under GLC 223A, because Women and Infants transacted business to a Massachusetts resident regarding her treatment in Massachusetts, and its negligent acts caused injury within the Commonwealth. 9 Women and Infants transacted business in the Commonwealth by accepting a reef-and-al from Massachusetts General Hospital and providing medical evaluation and treatment services to Lindsay, a Massachusetts resident, for a condition being actively managed by Massachusetts healthcare providers. Women and Infants knew that Lindsay was a Massachusetts resident who would return to Massachusetts for ongoing care and that its treatment recommendations would be implemented by Massachusetts providers. Women and Infants operates a specialized postpartum mental health program that sends patients from the New England region, including Massachusetts. AID derives substantial revenue from Massachusetts patients. Women and Infants negligent acts in Rhode Island caused tortious injury to Lindsay in Massachusetts. 10. Venue is proper in this court pursuant to GLC 223, Section 1, 11. Lindsay Marie Clancy, born August 11, 1990. Her formative years BV consistent academic excellence, culminating in a distinguished record Clio College and a rigorous accelerated nursing program at Massachusetts General Hospital. 12. Lindsay's 9-year tenure as a labor and delivery nurse at Massachusetts General Hospital demonstrated notable professional competence and personal fulfillment. She was passionate about nursing and dedicated to her patients. 13. Lindsay married Patrick Clancy in December 2016, and they established their family home in Duxbury, Massachusetts. 14. Lindsay and Patrick had 3 children, Cora Marie Clancy, born December 24th, 2017. Dawson William Clancy, born September 30th, 2019. Dawson William Clancy. As described by Patrick Clancy, before Lindsay became into being a mom, even over-dedicated, worked twice as hard as most. She rarely took a break to rest. Lindsay loved our children and never took her frustration out on the kids. She remained as affectionate with the kids as Aloud's. Lindsay's mother-in-law Susan Clancy testified in grand jury proceedings that she loved even thing about Lindsay. She was a fun-loving, doting VVVANCL mother. She loved her kids, and she VVA's a nurturing mother. VVHO smiled all the time. Lindsay's sister, Allison Olga, described Lindsay as the kind person who cares deeply for the people she loves. She shows up for the celebrations and Viv writes hand-written notes to show her love and appreciation. She's also there in times of need, and finds just the right words to provide comfort and support. 18. Lindsay consistently conveyed profound affection for her children and her husband. She had never previously engaged in any form of physical harm towards her children. B. Lindsay S. Prior postpartum history. 19. During Lindsay's first pregnancy with Cora, she experienced anxiety due to an abnormal ultrasound finding that later resolved. She experienced some anxiety during the postpartum period but returned to part-time work AID breastfed for 1 year without incident. During the postpartum period following her second child, Dawson's birth, Lindsay was initially elated with increased energy. Patrick described that she had manic behavior for multiple days. In October 2020, she had an episode of decluttering to simplify her life, obsessively cleaning and discarding items. She said she felt amazingly on top of things. Her thoughts raced and she constantly felt pressure to be active. 21. After her second pregnancy, anxiety emerged at approximately 2 months postpartum. Although Lindsay was offered Zoloft by a psychiatrist, she declined due to concerns about breastfeeding. Her symptoms resolved through exercise, healthy diet, meditation, and several therapy sessions. 22. These prior postpartum episodes, including the hypomanic symptoms to avenge Dawson's birth, were critical indicators that should have alerted competent psychiatric providers to the risk of bipolar disorder and the potential for more severe postpartum psychiatric complications following subsequent pregnancies. See third pregnancy and initial postpartum period. 23. Lindsay gave birth to Callan on May 26, 2022. Both Patrick and Lindsay took parental leave following Callan's birth. 25. Lindsay demonstrated significant activation and hypomanic behavior, including an extensive program of exercise beginning only 1 week after delivery.